Hi, I'm Raisa, Associate Editor at Radiology and Training. I am going to briefly explain the value of cardiac chamber ratios in predicting the risk of cardiac events. Cardiac chamber interactions are complex, and relative alterations in chamber volumes could impact heart function and equilibrium. In this study, the authors hypothesized that relative imbalances in chamber volume, represented by volume ratios, may predict cardiac events in individuals free of cardiac disease at baseline. They studied a diverse cohort from the multi-ethnic study of atherosclerosis. Participants underwent 1.5 Tesla cardiac MRI, cine images were obtained, chamber volumes were calculated with image processing software. Left-right ventricular volume ratio was calculated at end diastole, left-right atrial volume index was calculated at end systole. In 4,073 participants, the mean left right ventricular volume ratio was 1.06 plus or minus 0.16 and was tightly maintained between zero point 0.8 and 1.3. Over 17.8 years, 239 participants developed heart failure, 772 developed atrial fibrillation, and 906 died. A high left right ventricular volume ratio of over 1.3 increased the risk of heart failure, atrial fibrillation, and death, even with normal individual chamber volumes. A high left right atrial volume index of over 2 increased the risk of heart failure and atrial fibrillation, even with normal ventricular ratio. And a combined high atrial and ventricular ratio was an even stronger predictor of these events. This study explored the interdependence of cardiac chambers and found that left right ventricular volume ratio and left right atrial volume index are predictive of incident cardiac events. This shows that cardiac chamber volume ratios could be a practical, non invasive tool to re stratify the clinical risk of cardiac events in patients who are deemed to have normal individual chamber volumes.